video, I will be explaining about application of CT scans to diagnose dementia. Dementia is an acquired condition involving multiple cognitive impairment that could interfere with activities of daily living. Memory impairment is one of the most common deficits. Dementia happens when one's healthy neurons, which is the nerve cells in the brain, stop working, lost connections with other brain cells, and die. There are a few procedures that may be used to diagnose dementia. One of them is brain scans. Brain structure can be scanned using a few methods such as computed tomography, or known as CT scan, magnetic resonance imaging or MRI, and positron emission tomography, which is also known as PET scan. In this video, I will only explain how CT scan is used to diagnose the disease. CT scans uses X-rays to detect brain structure and show evidence of brain atrophy, strokes and ischemia, and also detect other problems such as hydrocephalus and subdural hematomas. Sometimes contrast material is injected into an arm vein to enhance the images. Possible advantages of CT are lower cost, shorter acquisition time, making it more adaptable to patients with poor compliance, and the possibility that it can be performed in patients with metal devices such as a pacemaker. In CT, X-ray slice data are generated using an X-ray sources that rotates around the object. X-ray sensors are positioned on the opposite side of the circle from the X-ray source. Once the scan data have been acquired, they must be processed using a form of tomographic reconstruction, which produces a series of cross-sectional images. The most common technique in general use is filtered back projection, which is straightforward to implement and can be computed rapidly. The role of the CT scan in degenerative dementias, mainly Alzheimer's diseases, also known as AD, is to exclude other evident causes of cognitive decline, to appreciate cortical atrophy, and to outline the possible coexistence of vascular disease. Medial temporal lobe atrophy is nowadays considered one of the neuroimaging marks of AD. It is difficult to see on CT scan. However, if appropriate orientation of the CT scanner is applied, images are formed. According to the Jobs procedure, a section plane 20-degree caudal to the orbitometer line in 2 mm contiguous slices through the posterior fossa is needed. The role of CT in vascular dementia is not only to detect the presence of vascular changes, but also to quantify the severity of these vascular changes as they relate to the clinical picture. Vascular dementia has different etiologies and mechanisms. The main subtypes are small vessel disease dementia, multi-infarct dementia, strategic infarct dementia. On CT, small vessel vascular dementia is characterized by the presence of lacunes and white matter changes. In multi-infarct dementia, the multiple infarcts are located in cortical and/or subcortical areas. In strategic infarct dementia, the single lesion can be either cortical or lacuna. Typical locations of strategic lacuna infarcts are the thalamus, internal capsule, particularly the genu and head of the caudate nucleus. For hemorrhagic dementia, intraparenchymal blood is easily detected by CT. There are two major causes of intraparenchymal spontaneous hemorrhage: hypertensive small vessel disease and amyloid angiopathy. The typical location is in subcortical regions, such as thalamus, basal ganglia, internal capsule, pons, and cerebellum. Hemorrhages from cerebral amyloid angiopathy are usually lobar and involve the cortex. In the chronic stages, CT will show only the residual brain lesions. On CT scans, white matter changes are seen as hypodense bilateral, usually symmetric areas which are typically located in the periventricular and subcortical white matter.
Before scanning, patients must be fasting for 4 to 6 hours and injected contrast agent if needed. Patient must lie down in supine position and the scan interval should be in range of 7 to 10 millimeters. That's all from me. Thank you for watching.